Hi there, friend. I'm doing this off TikTok because it's going to be longer than 3 minutes. And I wrote everything down in my little diary journal thing. So I'm going to do a little story time. And if you hear my dog barking, that's because my dog still hasn't settled down. And she's right next to me too. So yeah. So anyways, I started off in my teenage years having some trouble with my back. So the thing is I ended up with a spinal injury. I used to have bulging herniated discs in my spine when I was 14, and I got injections for them all the time. And I had migraines. I would have joint dislocations, but I just kind of blew them off. And I never really noticed it because I never really knew what was wrong. I would throw up every morning, just bile, and that was when I was 15. I have chronic pancreatitis, and that was something that I went to the hospital quite frequently for. I was always in there. I was about 15 and 16 when I had that all the time, but now it's chronic and it's something that's autoimmune. So by the time I was 18, I had a catheter, a indwelling, and now I have a urostomy. And by the time I was 20, I had a suprapubic catheter, and that's where they surgically implant it. Well, they don't implant it, they do make a tunnel for it in your bladder, and then you just change it, but they have to make a hole for it. So I had that until just in February. I actually just had my surgery, and I'm only 2-3 months post-op. So yay, I'm actually doing pretty well with my ostomy. And I wrote down all kinds of stuff that I suffer with, and stuff that I've had, stuff that that are symptoms that are comorbidities of Ehlers-Danlos that people might think, well, I've never had that, but it doesn't make you not have it. It doesn't make you not be able to have it. Some people might not have it. Some people might have it. So I have Raynaud's, which is where your hands and your feet turn purple, get kind of pruny-ish when it's cold or something like that. So it's my hand and my feet. I have scoliosis and just mild curvature of my back. I have POTS, which is postural orthostatic tachycardia syndrome, which causes syncope. When I stand up, my heart rate goes up, my blood pressure drops. So I pass out, and I feel very sick all the time from it. You can have all kinds of symptoms. I have frequent joint dislocations, which means you can be double jointed and your joints will bend really far. When you get tested for hypermobile Ehlers-Danlos syndrome, or pretty much any type of Ehlers-Danlos syndrome, they will ask you to bend your joints, every single joint, your arms, your legs, your fingers. I had to do that for my geneticist. I passed the Baton score with everything. I had everything that the Baton score was. I also have insomnia. That was a big one. Sleep apnea, I have. PCOS, I have neurogenic bladder. That's why I had my bladder removed. That's to do with my spinal injury, and the spinal injury ended up being a spinal injury at L5S1. That is not to do with Ehlers-Danlos. I'm just naming off some of my diagnoses, but you can have any type of spinal problem with Ehlers-Danlos. But these are some of my symptoms, some of my diagnoses. I had migraines and seizures. Those are symptoms of Ehlers-Danlos. You can have epilepsy. You can have just a seizure disorder. I have GERD. That's a symptom of acid reflux. You can have gastroparesis. I do have gastroparesis. Food and drug allergies, mast cell activation syndrome. So yes, that's a big one for me. I started off having very sensitivity to foods and drugs, medications. And I also have hip dysplasia, which means just like your hips, mine are bilateral, so it means both. So obviously my hips are not the best. Electrolyte imbalances. Yeah, I'm not even gonna get in that one. I think everybody already knows that one. Dry eyes, hair loss was a big one for me. I have Sjogren's syndrome and RA, which is rheumatoid arthritis, and you can have that as well as Ehlers-Danlos on top of it. It causes autoimmune problems. TMJ, which is your jaw. Fibromyalgia, chronic fatigue, chronic pain of all kinds. You can have a lot of chronic fatigue and chronic pain. I have speech loss. I have speech loss from my esophagus. I have esophageal dysmotility, which means my esophagus works. Oh, it doesn't work from here to here, but it works here. And when I swallow, I don't have the initiation to swallow. I've mentioned it in some of my videos. And it's also neurological. And my hearing loss is biomechanical and neurological, which means my bone in my ear is, it bounces, and then it's neurological as well. I have anxiety, depression. That can be a sign, because as well as having a physical disability, you can also have depression, because having a physical disability can wear on your mental health. And that's with any kind of physical disability, but that's why you are supposed to have a good support system with friends and stuff like that. And it's always good to have friends, and I'm always here. But anyways, I have liver disease. You can have no burp syndrome. I've never really heard of it until I knew I couldn't burp, and I have no burp syndrome. So it's really just having trouble burping, not burping at all. That was one of my symptoms. Nausea, vomiting, that's normal. And odonophagia for me, which is trouble chewing. So I've been diagnosed with that, as well as esophageal dysmotility, intestinal dysmotility, and gastroparesis. But most of my symptoms are just things like that. But symptoms and signs of Ehlers-Danlos are stretchy skin. I don't like doing it on my neck because I don't like pulling my neck, but you can just pull your skin like that. My face is swollen right now because I'm taking a steroid, so it's kind of like swollen, but my skin on my hands are very stretchy. Stretchy skin, joints that bend, they're bendy joints. I had a lot of pain. I have a lot of pain. I have chronic pain very bad. I'm on pain meds. I'm on a lot of pain meds. I have a spastic disorder. That's how part of it they found out. My joints will flail out. I also have Tourette's. And some of it is from stress. My Tourette's gets triggered by stress. It gets triggered by sleep, not sleeping enough. So Tourette's can be with Ehlers-Danlos. I'm not really sure, but I'm not really sure if Tourette's is from Ehlers-Danlos, but my doctor told me it was from my Ehlers-Danlos. My hearing problem is from my Ehlers-Danlos. So if you have a hearing problem, get checked. But my time is running out, so this is a very long video, and I am glad I got to explain it all, and I really hope I helped. But just remember, not everybody can have this, and not everybody is the same, but I really hope I can help, because I just want to help. And Ehlers-Danlos syndrome isn't gonna beat you, because it didn't beat me yet. And it's not the end. It's not the end. And I'm always here, and I'm always open for messages. I'm always here for anybody. Thank you.